How is serous otitis media different from a typical ear infection? Imagine your ears are like tiny sound chambers that help you hear clearly. Sometimes, these chambers can fill up with fluid, but not all fluid is the same. Serous otitis media is a condition where clear, non-infected fluid builds up behind the eardrum. It's like a small puddle that sits there without causing harm or infection. In contrast, a typical ear infection, called acute otitis media, involves an active fight happening inside the ear. Bacteria or viruses invade the middle ear, causing inflammation, swelling, and often pus. This makes the ear feel painful, and the eardrum turns red and bulges out. When a child has a typical ear infection, they might tug at their ear, cry more, have trouble sleeping, and develop a fever. Sometimes, fluid leaks from the ear if the eardrum bursts. The pain and fever are signs of the body fighting an infection. On the other hand, serous otitis media usually doesn't cause pain or fever. Instead, children might notice a feeling of fullness or muffled hearing. The eardrum might look dull or slightly retracted during a doctor's exam, but it isn't red or swollen like in an infection. The causes of these two conditions are different too. A typical ear infection often follows a cold or respiratory illness. When the eustachian tube, which connects the middle ear to the throat, becomes blocked by swelling or mucus, bacteria or viruses can get trapped and cause infection. The body responds with inflammation and pus. Serous otitis media happens when the eustachian tube doesn't work properly, but there's no infection. Fluid just collects because it can't drain out. This can happen after an infection has cleared or because of allergies or other factors that block the tube. Treatment also varies. Bacterial ear infections are often treated with antibiotics if needed, especially if the child has severe pain or fever. Many infections get better on their own within a few days. For serous otitis media, doctors usually watch and wait because there's no infection to fight. Most of the time, the fluid clears up on its own within weeks or months. If the fluid sticks around and causes hearing problems or speech delays, doctors might suggest procedures like placing tiny tubes in the ears to help drain the fluid. It's important to remember that both conditions are common in children because their eustachian tubes are shorter and more horizontal, which makes fluid buildup easier. While a typical ear infection involves active bacteria or viruses, serous otitis media is just fluid without infection. Recognizing these differences helps ensure children get the right treatment and avoid unnecessary antibiotics. If a child shows signs of ear pain, trouble hearing, or fever, it's best to consult a healthcare professional for an accurate diagnosis.